Now to our very first story. Non-governmental organization SG Mobile Healthcare has advised women in northern parts of Ghana to develop the habit of frequent breast screening to avoid risks of suffering breast cancer. According to the world-based NGO that is into health, sanitation, hygiene and research, a woman's breast is one of the most valuable and sensitive body parts which should be properly managed.
The one-day free breast cancer sensitization and screening was coupled with a presentation on minor disorders in pregnancy for women across varied sectors. The beneficiaries, mostly women, were advised to regularly examine their breasts for early detection of abnormalities and seek early medical care. The 2020 Complete Women Conference is part of a month-long campaign to increase awareness and support early detection and treatment of breast cancer. Addressing the gathering, Executive Director of SG Mobile Healthcare, Mumuni Latif, said the conference is one of the organization's way of volunteering for health as their core mandate. He, however, expressed worries about a few misconceptions some people have towards the use of contraceptives and breast screening.
Complete Women Conference, we said, was targeted probably only women because we identified that various women groups have certain things they would love to have themselves behind closed doors and discuss amongst themselves. This opportunity hasn't always come in ordinary days. As a team, we sat behind and said we needed to create an avenue where women would have the privilege of meeting resource personnel, ask questions as many as they can, and have them addressed for them. We have social myth and misunderstanding. The moment we started gathering women behind closed doors, many people started suspecting certain things. I remember serving at PC Chief's compound as a young community health officer. A man approached us during a community dinner and suggested that because we've been giving their women contraceptives, even their shea trees no longer bear fruits. So with these myths and misunderstandings, each time we are calling women, we face huge challenge, especially with attendance.
Chief Gynecologist Dr. Banabass Gandau, who gave a presentation on breast cancer, admonished women to regularly undertake breast examination with the assistance of relatives or health professionals, as it is the only screening without any cost implication.
It is the only condition that when you are screening it, there are no mistakes. And you can repeat it several times if you are doing it well without any harm to the breast or your health. You can do it weekly, you can do it monthly, because breast cancer is real worldwide. And even those who self-examine themselves, you realize that breast cancer can surprise them.
Delivering a keynote address, Acting Upper West Regional Director of Health Service, Dr. Damian Punguyiri, cautioned the public to be wary of contracting meningitis as the hot season approaches.
Last year, this region was hardly hit by meningitis. Indeed, meningitis took more lives in the region than COVID-19. Over 350 cases of meningitis were reported, with 50 unfortunate deaths. What it means is that as a region, we need to keep the issues of meningitis at the center of our lives.
This year's Complete Woman Conference was organized under the theme, An Ideal Woman in Challenging Abnormal Times.
Still